Practitioner here. The title of our talk tonight is Through Thick and Thin, Where is All My Hair Going? I've had many patients that are so confused about their hair thinning as time goes on with aging, and almost as confusing as I think I started too soon. But anyway, I'm Carolyn Zaumeyer, nurse practitioner here at Low T, Florida. And our title is Through Thick and Thin, Where's All My Hair Going? It's almost as perplexing as how did that little soft spot, little tire end up in front of us, with aging. It's not fun, but we can fight it. So we're live streaming on Facebook on the Low TE Florida page. And during the next 30-40 minutes, if you have any questions for me, you can send them on Facebook. And if I don't get to your question, I will message you with my thoughts. I'm going over a lot of different causes and treatments, so you may want to get a pen and paper and take a few notes because there's a lot to it. Tonight's topic, thinning hair, what could be the cause and how can I fix it? Why this topic? I'm not a hair expert. My practice focuses on hormone optimization using the BioT pellet system. I'm fortunate that my practice is quite successful and I see many patients during the day. And several years ago, I noticed that many men and women were complaining of thinning hair when they came in for their initial consultation before they even had any treatment. So as I've done over the years, when I see a common complaint, I dig a little deeper. I want to create a handout to give my patients explaining thinning hair and to give them some things to think about and maybe some things that they could change and maybe some treatments. So while I was doing this, as I was compiling my information, it just kept growing and growing and growing to the point that I felt like, oh my gosh, I'm going to have to write a book on thinning hair. And that wasn't my goal. I've written books and it's not my goal to write a book on thinning hair. So I decided I should just share it with you through Facebook Live. So I hope you learn a few nuggets, maybe find some understanding as to what you're going through, why you're going through it, and what we can do to make you look your best. So we're going to go over what is normal hair and normal hair growth, what causes the hair changes, and what are some of the things that we can do to slow down or even stop the thinning. So thinning hair, what could be the cause? How can I fix it? In my practice, I have many men and women that are concerned about hair loss. A full thick of hair is a sign of vitality, youth, beauty, helps with your self-esteem. So who doesn't want that? Like skin, hair ages too. Hair can age more gracefully than on some versus others, and the same with skin. Some people's skin ages better than others. So it's a rare person that'll have the same full head of hair at 60 that he or she had as a teenager. So there's many causes of thinning or baldness. Most of our average daily hair loss is within normal ranges. We're simply seeing more in our daily hair loss with our daily showers and our brushes than we're used to. So thinning is normal with aging. And once we get that through our head that it is normal to have hair loss, the normal average daily hair loss is around 100 to 150 hairs per day. Sometimes you're just maybe focusing in on it more than you had in the past. Maybe you're not as busy now that we're working from home with the virus. But if you feel like you do have this hair loss, you'll see significantly more than 150 hairs in your hand, hairbrush, or shower drain, or just even throughout the day on your clothes or your couch or such. And then you may have abnormal hair loss. About 90% of your 100,000 hair follicles are producing hair at any given time. The other 10% are resting, and the hair falls out after about 2 to 3 months. It's replaced with new hair, and the growth cycle starts all over again. In the first years of hormone therapy, you may notice a little bit more of your hair coming out. The hormones encourage the hair follicles to grow and to release the old hair. So you need to find out if your hair loss was caused by an illness. Do you have something going on that we don't know about? Medications you're taking, thyroid conditions, vitamin or hormone deficiencies. Maybe you've had a radical diet change, using different products or treatments for your hair, or maybe some other serious causes of hair loss, but you kind of need to get to the bottom of it. So what prompts me to talk about this is that many people want to blame high testosterone level for thinning hair. And it gets me because many of my female patients that come in on their very first visit before we've done any treatment at all, and their labs are so low you can't even measure their testosterone, are complaining of thinning hair. So does it make sense that the testosterone is causing that? Not so much. However, what you'll hear tonight is that if you are on testosterone therapy, the dosing of your testosterone treatment is critical. And that's why I love the BioT method so much, is because we actually scientifically dose it for you. So we know exactly what your body's going to need. We know exactly by putting in your medical history as well as your lab values into the computer, it populates a dose that will be right for your body. So we know we're not overshooting it. And then we test it along the way just to make sure that you're not too high. It was once explained to me that testosterone therapy, you want to think about filling up a glass of water, and you want to fill it up to the brim, but you don't want it to spill over the top. If it's too much and it spills over the top, it can turn into dihydrotestosterone. And we don't want that, because that can encourage male pattern baldness, hair loss, and some other things that are just not good. So we don't want to adversely affect our hair follicles with testosterone. Now, the other part of the puzzle is estrogen. While estrogen levels are high, women have full, thick hair like when we were younger. But when the estrogen levels drop, such as after a pregnancy or during and after menopause, the hair enters that resting phase where it soon falls out and becomes thinning and even balding patches. So optimizing your hormones may be the answer to get those hormones back into your body to get your hair follicles feeling good. So here are the facts. Over 85% of American men over 50 will have significantly thinning hair. What's even more shocking is over 80% of women will experience noticeable hair loss by the age of 60. That's a lot. Thinning hair can make you feel unhealthy, unattractive, or even older than you actually are. So let's explore some possible causes of thinning hair. Family history, heredity. That's the most common cause of hair loss. It's a hereditary condition called male pattern baldness or female pattern baldness, and it usually occurs gradually, slowly, over age. And it's in a predictable patterns, receding hairline and bald spots in men, and overall thinning hair in women. This type of hair loss is not preventable. Not saying there aren't things we can do to make it less, but that one is unpreventable. So stress, at this time, stress, whether it's physical or emotional stress, stress can mess with your hair. Physical stress, such as having a surgery, an illness, or even giving birth, can shock your follicles into hibernation. It may actually show up several months after the event. So if you're noticing a dramatic loss of hair, think back. What was going on in your life maybe 2 or 3 months ago? Were you in surgery? Did you have anesthesia? Did you have a baby? It may actually show up months later. So just kind of think back about that. In extreme cases of stress, your scalp may start to shed into handfuls of hair. This is because an overabundance of anxiety and pressure interrupts the healthy hair growth process, during which we continuously sprout and lose our hair. During periods when you're maxed out, your hair can't manage its normal routine, and instead it falls out more than it normally would. Certain medical conditions such as diabetes, polycystic ovarian syndrome, thyroid issues, and lupus can also cause hair loss. Psychological stress can do the same number on your scalp. Your body reacts to stress in the same way, whether it's physical or emotional stress. So what can you do? Try stress reduction, yoga, meditation, exercise, talk therapy, putting relaxation time in your schedule. Sometimes we're just so busy, we don't take a minute to breathe. Nutritious eating can make you feel better, and limiting your exposure to news, especially these days, that can really add to your stress level. Maybe get bits and pieces, but not watch the whole thing. I know this sounds silly, but you may be able to reduce some of the psychological stress your body's experiencing. And with the stress of this coronavirus, it's a miracle that we're not all bald. Your hair is thirsty for robust nutrients and supplements, so make sure to give it what it needs topically and internally. You can also take vitamins with essential nutrients that promote hair health. Thyroid. Hair loss is another sign that your thyroid hormones may be out of whack. Both hypothyroid and hyperthyroid can wreak havoc on your hair. In most cases, the hair will grow back once a thyroid disorder is treated. A sluggish thyroid can lead to dry, frizzy, brittle, thinning hair. As BioT providers, we look a little deeper into thyroid than traditional medicine doctors. We look at the free T3, the hormone, the thyroid hormone that's actually circulating in your body that helps with your mental clarity, your energy, your metabolism for weight, and also for your hair and nails. And while traditional medicine looks only at the TSH, which is that's the hormone that it's your brain telling your thyroid to produce the hormone, we look at the whole picture. So we test your thyroid a little deeper than the average bear. So we want to know what's really going on inside of you so that we can guide you to your best bet. So let's see. What can you do? You can have your thyroid checked. We do that at our office all the time. I tend to optimize thyroid with NP thyroid versus a synthetic thyroid like levothyroxine or Synthroid. NP thyroid is American-based. It's all sourced here and is pure in that it has less additives, dyes, and all that stuff. And I take it myself, and I've been really, really happy with it. Traditional practitioners look at that TSH on your labs and say, you're normal, but why do I feel tired all the time? Why don't I have any get up and go? Why am I gaining weight? And what happened to my hair? So you need to remember that normal isn't optimal. You may need to try to find a more thorough practitioner that will check you for your free T3, the circulating hormone that if it's low causes that hair loss. So hormones, with declining hormones, natural aging, you may notice thinning of your hair. Your scalp's production of the natural oils also lowers at this time, so you may notice texture changes, maybe a little bit more dry and wiry, maybe brittle. Most women's hair thins with menopause, and we don't like it, but it does. It's kind of like that little weight gain that we get. We don't like it, we fight it, and we can fight this. So what can you do? You can consult with a BioT provider like me. If you're not in South Florida, you can go to the website, biotmedical.com, to find a provider near you and have your hormones, thyroid, and nutrients optimized. Many patients notice a nice change in their hair growth once their hormones and thyroid nutrients are all restored to healthy levels, but it takes time. It's not an overnight thing. You can change your shampoo and cream rinse to super moisturizing products that can help on the outside, hair masks, hydrating shampoos, leave-in conditioners, and even minoxidil and prescription medications may help. We'll go into that in just a little bit. Pollution. When smog, dust, smoke land on your hair and scalp, the molecules may penetrate your hair follicles and skin, leading to damage that can cause irritation. This may result in an oily hair, scalp, itching and flaking, and you just feel icky. So what can you do? Wash your hair often. Really working in the shampoo into the scalp removes as many lingering pollutants as possible. I have one patient that swears by a Listerine final rinse. Using Listerine as kind of like an astringent, clearing off the old shedding skin and the pores that are blocked with oils and old skin. So there may be something to this. I saw a close-up view of a menopausal scalp the other day, and it looked like the surface of the moon. You could land a space shuttle on that thing. So I thought about the hair follicles being clogged with their hair products, skin oils, pollution, and the idea isn't so far-fetched. I noticed this one day after being out on the boat is sun damage. We get sun damage on our face and body. And have you ever thought about your hair getting damaged as well? Your hair and scalp both need protection from the sun. Too much sun can damage the molecules in your hair, stealing the luster, shine, and color. And as the sun hits your hair, some of the UV light is reflected towards the hair follicles, producing sun damage that can cause your hair to thin out. Protect your hair from sunlight and other sources of UV light. So what can you do? Cover up your hair, wear a hat, and get a nice hat. Or apply UV protective product that you can get at the beauty supply to help filter the rays and protect your hair. There's another culprit for thinning hair, blow drying. with the intense heat, it injures the protective cuticle layers. So you want to hold the blow dryer further away, at least 6 inches away from your hair, and move the barrel continuously to lessen the damage. The Derm store online has one that's really great and lower heat and more protective for your hair. Brushing your hair when it's wet can cause split ends and have it pull out. So try using a wide tooth comb, especially when it's wet, to avoid pulling out the hair. So you can run a detangling product through your hair in a wide tooth comb. I used to ride a motorcycle, and when we go on the boat, my hair gets all tangled up. So in the shower, I'll put on a lot of conditioner, let it sit for a couple of minutes, and then use a wide tooth comb to gently comb it through. And I don't lose any hair in my comb with that. So that might be a good thing for you. You can also put on coconut oil before you shower, or even after when you're styling your hair, and it gives you a nice moisture and condition, but it also makes you smell good. You feel like you're back on the islands. So coloring, hair dye must be rinsed out thoroughly, whether you're doing it yourself or having somebody else do it. Make sure the color's rinsed completely. If not, the color can stay on the scalp and block your hair growth. So hairspray, many women with thinning hair use a lot of hairspray to sculpt over their thin spots. The alcohol in the sprays can be very drying and create strands that are apt to break. So what can you do? You can use a dry shampoo to lift at the root. I see that written up on the movie stars all the time that they do that. And then use a blast of the cool blow dryer to set it. And for more body, spray your brush with the hairspray and then brush it through your hair. Can't believe I'm talking about hair so much. Hot styling tools, flat irons, curling irons, they all dry out and cook your hair, especially if you hold them on your hair too long. So if you're using them, use them for the shortest amount of time as possible. So I guess I opened up this can of worms, and there are certain hairstyles and treatments that can lead to thinning hair. Excessive hairstyling or hairstyles, wearing your hair real tight in a ponytail, in a bun, and pigtails, cornrows. It can cause a hair loss called traction alopecia. And hot oil hair treatments and permanents can cause inflammation on the hair follicles and lead to hair loss. If scarring occurs, then the hair loss can be permanent. It's not good. So avoid the tight hairstyles such as braids, buns, ponytails. Avoid compulsive twisting and use a soft fabric tiebacks. Your diet, not eating enough protein. Protein is a building block for your hair. Proteins from your food is broken down into amino acids that are then used to form other proteins like the keratin that makes up 95% of your hair. So what can you do? Make sure your diet includes at least 60 grams of protein per day. And some proteins you may want to include are lean meats, eggs, cheese, tofu, nuts, yogurt, beans, and lentils. So crash dieting. If you're on an extreme low-calorie diet, your hair may suffer, such as the HCG. When your body is low on nutrients coming in, it prioritizes and sends the nutrients to the vital organs, and your hair can suffer. Your hair requires a lot of nutrients, blood flow, and energy to grow. So what can you do? In addition to eating protein, keep your hair shiny and thick by filling your diet with fiber-packed carbs like sweet potatoes, quinoa, and healthy fats, avocado, and olive oil. But watch out for your calorie count with that. So not enough vegetables, add some color to your plate. We hear this all the time, yellow, greens, orange. Not enough exercise. Exercise will increase your heart rate and increase the blood flow and oil production in your scalp, which can increase the hair growth. So 30 minutes of exercise, 5 to 6 days a week could really help. Medications and supplements. This is big. Hair loss can be a side effect of certain drugs, such as those used for cancer, arthritis, depression, heart problems, GERD, like the omeprazole or the Prilosec, non-steroidal anti-inflammatories like Motrin, Advil. If you're taking a lot of those, it can affect your hair. Gout, high blood pressure, some high blood pressure medicines, birth control, antibiotics, and more. So we want to look at what you're taking and look at the potential side effects, because that could be part of it. If you notice a significant increase in hair loss, check any new prescriptions or supplements that you're taking just for any potential side effects. If you're one of those few that's still smoking, stop. Just stop. Some studies are showing an association between male pattern baldness and smoking. So it's not good to be doing. When I first noticed, I've been on the hormones, on bioidentical hormones, on the pellet therapy for 7+ years. And a couple years ago, I noticed a few more hairs in my brush, a little bit more in the shower drain, and I didn't like it. I started paying a little bit more attention because I've always had full hair, lots of hair, good hair. I was blessed by the hair gods, but all of a sudden I was noticing it and it made me very nervous. So this patient came in. I still remember the day. She's a beautiful girl, and she was my same age. She was a girl, 58 at the time, and she had this lush red hair and looked like she could be a hair model. So I said to her, "Okay, what's with the hair?" And she says, "You won't believe this, but 6 months ago I have bald spots and thinning." And I said, "Well, what did you do?" And she's very wealthy, and she says, "Well, I went to the best hair doctor in town." I'm like, "Oh, well, what did he say?" And I pull out my ink pen. I'm going to write this down. And he had told her to take Viviscal. And Viviscal is a hair vitamin. You can find it at Walgreens. There's an infomercial for it and the whole bit. So I thought, well, let me investigate this. Before I recommend it for anybody, let me check it out and test it myself. So once I started doing my research, I found the studies were really good. It had been around for like 20 years, and it showed new hair growth, and the patient testimonials were fabulous. So I thought, well, what the heck? If I'm going to take it, because it was pricey, if I'm going to take it, I'm going to take the best they have, and they had a professional strength. So I ordered those in, and I started them along with one of my patients, or no, a couple of my patients, and everybody started noticing like within a month or two that their hairline was filling in, that they're seeing a thickness in their hair, which is great. And so I was busy, and so a couple months later, because it takes a while for this to change, I didn't expect it to be overnight. I started looking in the mirror, and I thought, oh my gosh, I had new hair growth going all around the front of my head, all around my hairline. The sides here had filled in. I used to have like a high temple there, and it was silver, but it filled in. And then it just was fuller, and my ponytail is now thicker. So I've been on the Viviscal Pro for over a year, and I think I'll probably be taking it forever. We have it available at our office. I'm not trying to sell you on it. I'm just telling you what I went through. But it's a good supplement. And it's not going to hurt you. The Viviscal Pro is different than the Viviscal that you can get at Walgreens or off the infomercial, because it has an extra protein in it. It's like I think it's from shark cartilage or some fish protein. So it's a good thing. There's several prescription things we can do. We need to talk because there's potential side effects with some of them, but what they're doing now is taking like minoxidil and mixing it, compounding it with the active ingredient in Latisse that we use for our eyelashes. And I was told by a pharmacist, a compounding pharmacist, that if you put that on your head, you will, and you have hair follicles, you will grow hair. And so that is something to try. So with all that information, what's your first step to resolving your issue? First, you want to look at your heredity, look at your mother, your aunts, your grandmother's hair, thick, thin, balding. What was their hair? Even maybe flip through the photo album and see what was going on with the women in your family. Look at your stress over the past 3 months, crash diets, anesthesia, surgery, hospitalizations, giving birth, immunizations, immune disorders, weight loss of 20 pounds or more, or even the coronavirus. Look at your medications and potential side effects. Get a full panel of blood work, including the thyroid, the vitamin D, B12, and your hormones. What are some of the treatments? It depends on what your labs show us and what your history tells us. We may be able to treat your thyroid, optimize your hormones, optimize your nutrients. And remember, besides vitamin A and D, B12 that we think of, the omega-3 fatty acids, think of those as moisture. They're going to help with your skin. They're going to help with your hair. Iodine, selenium, and zinc are important as well. We have the Viviscal Pro supplements at the office, and we have a lot of people that are on them that are very satisfied. A different treatment is Rochelle, our nurse practitioner at the office, can do what's called platelet-rich plasma, or PRP, scalp injections. Doesn't sound like much fun, but it really doesn't hurt. And they're the tiny little injections. And what that PRP does is it kind of acts like a fertilizer for your hair follicles and encourages your hair follicles to produce hair. Rogaine 5% foam, half a cap per day for women, and half a cap per day, twice a day for men. And this is the one we can have compounded with a Latisse, and it shuts down the shedding. So it really does work, but there are potential side effects. So there's the I can't even say it, Capillus cap. It's a laser cap. It's called red light therapy. And it's been around for quite some time and has fabulous reviews. I know of a doctor that has many patients using it. And they just came out with a new bottle where you only have to wear it for 6 minutes out of the day versus the 25 to 30 before. And there's great reviews on it. If you need a hookup for that, I know somebody that has them. If you are having other scalp issues, I know a fabulous dermatologist can do a little biopsy and help guide your treatment. And if it's really bad or past the point, then and need a little hair transplantation, even if it's just in a little area or whatever, I have a great guy for that too. So, in conclusion, there are many factors that go into hair thinning and balding. However, there's possible solutions. Whatever treatment or changes you make, I encourage you to take pictures before you start, and then maybe 3 to 6 months down the road. You'll want to take pictures of your part. You'll want to take pictures of your hairline if it's receding in your temples like mine was. And then also maybe the thickness of your ponytail, because you want to be able to actually measure if what you're doing is working, because a lot of the treatments aren't cheap. So if your healthcare hasn't put as much thought into hair as I have, you may want to schedule with me, Carolyn Zaumeyer, nurse practitioner at Low TE, Florida, and see how we can get you not only feeling your best, but looking your best as well. So I've got a few questions that came in. One of them is, where can I buy Viviscal Pro? We have it online on our website on lowteflorida.com on the supplement page down, I think it's down towards the bottom. And we have sales from time to time, so that's good. Then, oh, here we go. How do you suggest women start taking hormones, and how about men? Well, with that, it's the same as with the hair, that we need to do the full blood analysis, do a consultation, look at your medical history, pull it all together, and then get a nice plan worked out for you. So I'm getting distracted. Okay, here's one. Is there a blood test that will show if my testosterone is turning into dihydrotestosterone? I had mentioned that earlier. And there is, and we can do it at the office. And what that'll tell us is if your testosterone therapy is going a little too heavy, if you have a little too much or not, if it's overfilling that glass of water like we talked. Here's one. Does a scalp massage slow or improve hair loss? Well, a scalp massage feels good and it's relaxing. So it's going to help you reduce your stress, may increase the blood flow a little bit, but there's no scientific evidence that it does help prevent the thinning and hair loss. So I don't see any other questions. No? Okay. So if you do have questions, if you're watching this on a recording, you're welcome to give the office a call, set up a little consultation with me. And I believe we have it posted on there that it's a free consultation. So you might want to mention that you watched this and we'll go from there. So my office phone number is 954-791-4498. And if you like this video and would like to share it, I'd appreciate it. Thanks so much, and I hope you have a great night.